Join us for an enlightening conversation with Dr. Amy Link, a passionate pelvic floor therapist and advocate for holistic healing. Drawing from her personal journey with pelvic floor dysfunction, Dr. Amy understands the shame, confusion, and dismal that often accompany these challenges. In this episode, she'll share how to break free from the myths surrounding pelvic pain and incontinence, empowering you to embrace your body's amazing capacity to heal. We'll explore her expert approach and compassionate care, practical tips for reclaiming your wellness, and how healing extends beyond the physical to the emotional and spiritual. Whether you're on your own healing journey or simply curious to learn more, this episode is packed with inspiration and actionable insights. Welcome to the show, Dr. Amy. It is a pleasure to have you join us.
Hi, Leann. Thank you so much for having me. I'm so grateful to be here.
Thank you. Welcome back to the Happiness on Tap podcast, where we bring you inspiring stories, practical insights for a happier, more fulfilling life. Your go-to podcast for uplifting conversations that stir the heart and ignite the spirit. I'm your host, Leann Herron, and today we have a special guest, Dr. Amy Link, the founder of Sacred Roots Pelvic Health and Physical Therapy in Albuquerque, New Mexico. Dr. Amy Link is a devoted pelvic floor physical therapist and business owner who is passionate about empowering people to reclaim their lives free from bothersome symptoms. Too often, women are told that there is no solution to their pelvic pain or incontinence. But Dr. Amy is a firm believer in the body's incredible capacity to heal. She takes great joy in guiding individuals on their path to feeling better about their bodies. Outside of her professional life, Dr. Amy enjoys gardening, reading, and spending time outside with her husband, son, and 2 delightful pups. And Amy is committed to transforming her patient lives through compassionate care and expert therapy. So grab your favorite beverage and let's dive in. So, Dr. Amy, let's start from the beginning. What inspired you to create Sacred Roots?
Thank you for having me, Leann. So, I started my practice working a number of years at a large hospital outpatient practice here in Albuquerque. And while I'm incredibly grateful for my time I had there, I was also, especially after COVID, was finding myself very burnt out. Um, and a lot of my old coworkers too, we just found ourselves under this incredible administrative burden that was being pushed upon us, as well as, and I think this is the biggest thing, is the patient care was really going downhill, I would say, due to the demands of productivity and all the insurance requirements, documentation requirements. It kept getting a little worse and worse, I would say, over the years. And again, while I'm very grateful for my time there, I found myself not being able to treat patients how I really felt they should be treated. And this, I don't think this is any, it's not because that there's something wrong with the therapists that are treating at these places, but I just feel like that's the way our medical model is now, is a very zoomed in lens at a certain body part and not looking at the person as a whole. And so it was percolating in my brain for a couple years about what would it look like if I went off and started on my own. And finally, a couple years after COVID, I think COVID was a big kick in the butt because I couldn't stand it anymore. And so I finally was just went off and started Sacred Roots, which its mission is to just provide the absolute best patient-centered care possible. And I'll talk more about this, but looking at the person as a whole and not cutting corners when it comes to providing awesome care that where the patient feels heard and listened to. And so I started, it was just me doing everything, figuring everything out on my own. I was renting out a little room, treating patients there. And then now I'm in a larger office space and I have an awesome occupational therapist working with me, providing pelvic health and pelvic health therapy, as well as an admin assistant. So we're growing a little bit, which is really exciting.
Yeah, that is all very exciting because it's really hard to get established and making enough money that you can continue to invest and grow your business.
Yes, absolutely. I think, gosh, and we might be talking more about this, but yeah, it's like starting a business is not easy. I don't think I went into it. I think I went into it a little naive, just thinking that it was gonna be awesome and easy and smooth sailing. And so, but I'm often finding that there is a ton of personal growth that happens with owning your own business. And it's definitely not for people who want something easy to do. So, yeah.
Absolutely. I've learned those ups and downs myself.
Yes.
I've had an office for 3 years, but I've found that the overhead for me just really isn't necessary anymore.
Mhm.
And the reason I did that was, of course, because of COVID, because that's when I opened my business was in 2022. And I wanted to be able to offer coaching in person for people who are just coming out of COVID and needing that one-to-one contact. But as kind of time goes on, people are really accustomed to virtual everything, and we can have a coaching session while they're on their lunch hour break from work or whatever. And so I've decided to let go of my business when my lease is up and just stick with virtual coaching. But I love what you do, and I love the reason you started your own practice. I always, have the same kind of gripe, and anybody I talk to that's in the medical field will know this for me. Those limitations are just horrible, and that's when, I really started to focus on one, launching my podcast, two, my Choose Change platform, where I can bring people like you and put them in front of people so that they know there's other options out there. Because some of us, the options we get are just here's a referral, go see this doctor. And sometimes it's not even what you need. And then you've wasted time and money and, or here's a prescription. And so I'm not one that likes to take a bunch of medications. I don't like any medications. And so it's nice to, have options. And so that's what I really hope that my podcast does, is really share those options with a greater group of people.
Yes, absolutely. And I'm so happy that you have this platform to educate people because, and I agree completely with you, is someone might get a referral. Well, and just from my perspective, someone getting a referral for pelvic floor therapy, and then they go to a place where might not be well equipped to provide a really high quality standard of care. Maybe they're just placed in a room by themselves where they have a biofeedback probe inserted vaginally and they're just doing pulse for 30 minutes, and which is not good pelvic floor therapy. Spoiler alert. So, but then after that, their symptoms will be maybe the same, and maybe worse. And they will say, oh, pelvic floor therapy didn't work for me. And so then it's really disheartening because it's like, no, that is not good pelvic floor therapy. So that's one thing I really like to get the word out for, is that there are, like you said, other options And then again, it's maybe that would work for a particular person with their specific issues. That sort of biofeedback treatment may work well for that one person, but it's not going to work for everyone.
Absolutely. And it's, I'm like you, I'm all about holistic care. It's the whole body, mind, body, and spirit. Even with coaching, when somebody hires me to maybe do career coaching, that's not where I end up focused on, because we look at everything else. People who are experiencing burnout and overwhelm, and they're ready to move on to another job, but then it's affecting their home and it's affecting their finances. So, I like to focus on holistic care so that people learn how to get out of a stress response, that they know that there's other alternatives than just changing jobs or trying to launch their own business. If that's not necessarily the best option for them, they just need to kind of learn how to get out of that stress response, maybe learn better communication, how to ask for what you want, how to set boundaries, and that's everywhere. That's your relationship, that's your bosses, that's your coworkers. So I love that you do that as well.
Yes, absolutely.
So can you share some of the common issues that you help women with?
Yes. So a lot of the common issues we treat quite a wide variety of pelvic floor problems, but the big ones are, of course, leaking. So any sort of urinary incontinence. We also treat people with bowel issues as well. So any sort of constipation, IBS, um, about accidental bowel leakage, which is something people don't really want to talk with. It could be very shameful, and it's actually a common problem, especially in women who have had third or fourth degree perineal tears with childbirth.
Mm.
So it's actually quite a common thing, and so but it's something that can absolutely get better. Um, Also, we treat a ton of women who are experiencing any sort of pelvic pain. So pain with intercourse, menstrual pain, tailbone pain. We do a ton of hip and back pain that's not responding well to maybe orthopedic physical therapy or chiropractic care. So, because a lot of times, and the pelvic floor muscles are so closely connected to the sacroiliac joints, low
Mhm.
back, hips. So we do a lot of treatment with hip, low back pain, as well as we do pregnancy postpartum. That is that's a big bread and butter of our practice. So we see a lot of patients during their pregnancy. In fact, we encourage people to come to see us during their pregnancy if they can. For one, we make them more comfortable. So if they're having any sort of aches and pains during pregnancy, we would love for them to come see us so we can strengthen and get things working really nicely so they could be comfortable throughout their pregnancy. And then we also will see people who are not having any aches and pains, which is wonderful. But we also encourage them to come and even see us for a few visits during their pregnancy so we can assess their pelvic floor muscles before they give birth, see, okay, we're all told to do Kegels, right? And I was told when I was pregnant with my son by multiple aunties and grandmas that I should be doing my Kegels when I'm pregnant. But usually, and this is a little spoiler alert, I tell people I don't recommend Kegels during pregnancy because when that baby's born, these pelvic floor muscles need to get out. They need to lengthen and get out of the way. And so a lot of women, especially for their first pregnancy and first birth, their pelvic floor muscles are high and tight, and they have no idea how to relax those muscles and how to lengthen them. So we recommend they come see us during their pregnancy so they can learn how to get connected to their pelvic floor muscles and know exactly what we're talking about with lengthening their pelvic floors, relaxing their pelvic floors. And then we also teach them pushing techniques, birth positions, lots of stuff. So we love seeing our pregnant gals during pregnancy to prep for birth. And then, of course, postpartum, we see lots of gals postpartum. And usually I see this, I'm like, if you see me when you're pregnant, we don't have to spend as much time together when you're postpartum. So I see that a lot where I'm like, gosh, we only need a handful of visits postpartum just to get, work on core strengthening, hip strengthening, and maybe a little pelvic floor strengthening and that sort of thing. So we see a lot of postpartum gals as well. I also love my perimenopause women because there's a lot going on during perimenopause hormonally, and there's lots of changes in the pelvic floor muscles and the pelvic organs. I also and I've been trying to get the word out there more for seeing people post hysterectomy. There's lots of changes that I feel like surgeons, OBGYNs, and I don't know, through no fault of their own, make it seem like this is going to be a walk in the park to have a hysterectomy. And then so many women are having all sorts of strange symptoms afterwards. And so that is something that we see quite a bit of those gals, but I'd love to see more of them because it can make a huge difference.
And you hit all those areas where we all need somebody to listen to us, somebody to talk to us about those things. I think with the traditional Western medicine and medical care, they're still kind of behind the times. These medical students don't get a lot of education with regards to menopause and all these other wonderful things. They just kind of glaze over it, and it's such a small portion of what they learn. So seeing more and more women now that's their focus, because they know that that's the area that all women need guidance and care, and they're not going to get it from a standard OBGYN. I mean, I had my daughter at 17, and I was forced to have an OBGYN that was like my brother's girlfriend's OBGYN, and he was an old man, and he was awful and had no compassion. One, because I was so young. So he was just like, put off by the fact that I was 17 and having a baby. But he never talked to me about any of it. Complain about sciatic pain, and he couldn't even offer suggestions, or so I had like one of my aunts talk to me about using ice to kind of move the baby, to get the baby off your sciatic. And I think that it's wonderful what you do, to kind of go through all those stages, because even traditional I can't even think what it's called anymore, the pre-birth classes. It's been a long time since I've had a baby. My daughter is 36. That they just really didn't teach that either. They just teach you how to breathe and how to sit in one position. And, so you learn just by doing, or you learn from other family members. So I think it's great that, you really go into all those different areas to kind of help prepare women for childbirth, and then yet be there after the fact too, to kind of talk about like how to get those things back in place and tightened back up. And, I tour with both my kids. So, I think if I had had somebody to have those conversations with, it would have been so valuable.
Yes, absolutely. I can't believe and this is a soapbox I could go on and on about, but I can't believe we're in 2024 and the women's health is still incredibly, women's healthcare is just lacking. And I can't believe how many people I see who their doctors aren't even referring to pelvic floor therapy, even though they're like begging for help. I'm either leaking, I can't even have sex now, or there's so much, and their doctors will be like, oh, just do Kegels. I had a patient, this was years ago, but I had a patient who was having prolapse. She was young. She had a baby. She was young. And her doctor told her to do 1,000. Maybe that's exaggerating. Maybe it was less than that. It might have been like 200 or something, but it's an insane amount of Kegels every single day. Like do 200 every single day. And I was like, and then of course her symptoms were getting worse. And then so my first thing I told her was, stop doing Kegels right now. And so we need to work on some other things. And so, yeah, it's so helpful to just have someone take a look, and because it can be different for everyone. Unfortunately, there's not a one answer for everything. But even if you could go in for a couple visits to figure out what your particular problem is, it could be so helpful. And then to at least be like, okay, I know I need to work on these things. And then you're just on such a different trajectory, because issues that happen whenever you're young and you have a baby can you'll carry them with you throughout your life. And then once you start reaching perimenopause and menopausal, I often find I'm working with women even who are in their 60s, quite older, and they're having leaking. And I'm like, wow, this is an old perineal scar, and I can usually feel it. And I'm like,
Mhm.
this is part of your problem. It's adhesed. And so we need to get this scar moving a little better. And then get the whole pelvic floor working a lot better. And then it can make such a difference. So I usually am trying to tell people, not that it's never too late for pelvic floor therapy, but if you could come in a little earlier, it's going to be so much easier if you get coming closer to the issue, or when the issue started.
Mhm. And like I said, I think before we started recording, is it's lack of knowledge.
Yes.
It's just a general lack of knowledge, because your aunties and your grandmas and all of that, they had their knowledge, which they passed down to us. And, for me, even having sex conversations didn't happen at home. So I learned from school and from my friends who were all already having sex when we were way too young. And so, wow, surprise, I ended up pregnant at 17. Well, that's because I had nobody to talk to, nobody to tell me anything other than sex ed in, like, I don't know, middle school, late middle school. And it was one class, and I was with a pediatrician up until I got pregnant. And then the pediatrician was like, well, I can't treat you anymore. You need an adult doctor. And so those conversations never happened. And so,
Absolutely.
if we can find ways to have those conversations, to open those conversations, to get in front of people, that is the whole purpose of why I'm doing what I'm doing, is to get those conversations moving and provide people alternatives.
Absolutely.
Yeah. So you kind of talked a little bit about, where you were kind of stuck in doing traditional care when you worked at a hospital. Are there other, like, larger clinics? Does what you do in your smaller clinic kind of vary?
Yes, I love that question. Our approach, so yes, there are some larger clinics here that provide pelvic floor therapy. And our approach is different, and I'm going to talk more about it, but I just want to say I think that I'm not trying to say anything bad about any of the therapists in my area. I think OTs and PTs are some of the coolest people and have such a big heart. It's our medical model that puts people in boxes that allows them to treat in a certain way. So our approach is a little different compared to some of the larger high volume clinics. And there's quite a few ways that we're different, but kind of the bigger ones that I'm most passionate about is that we believe in continuity of care between the therapist and their patient. So and you'll find this in lots of different physical therapy clinics, is that usually patients are bounced around between the physical therapist, a tech, an aide, an assistant, and there's not that much quality time between that physical therapist and their patient. And so the patient might go in for 12 visits for physical therapy, but they might have seen the actual physical therapist like 3 to 4 times. And so they might see, so there's not that continuity of care versus with us, the patient is with their therapist throughout their entire plan of care with like dedicated pelvic therapist attention throughout the whole visit. And so, and that is helpful in the way is because not everyone is the same. Everyone is so different and carries with them different stories of why they're at where they are, different injuries, different compensations, all those sorts of things. And so we really need to be assessing patients every single visit. We want to be like, okay, of course, how you doing today? How'd you do after last time I saw you? We did this very specific treatment and we weren't just doing it for fun. We were trying to do something. We want to see how the patient is reacting to our treatments and our exercise program. And if they're not responding the way we would expect them to or that we want them to, we're usually missing a piece of the puzzle. So sometimes we have to be like, wait a second, that wasn't what I expected. And so then at that point, sometimes we need to zoom out a little bit and be like, okay, what do we need to change? And that's something I feel like all therapists do. But if there's not that continuity of care, if you're not seeing that same therapist every single visit, that might not happen for 4 visits. If you've been seeing a couple different therapists, it's not on their radar and things get missed. And then that zoom out doesn't happen to be like, oh, actually, wait, there's something else going on here. We need to figure out what it is. And so that is that's our approach. So we are very passionate about that. And then the second one, which I've alluded to already a little, is a very holistic whole body treatment. So in the larger clinics, people get their referrals from their doctors, and it's like, for orthopedic PT, it might be like ankle pain, or even pelvic floor therapy, it might be incontinence. And so it's very specific either to a body part or a very specific condition. And then so generally that one area is being treated for that at that clinic. And so, which is unfortunate because our whole body works as a system. And so we do, at Sacred Roots, we do 2 things in regards to treating holistically. The first thing we do is look at the person from a physical standpoint, their whole body from head to toe. So of course we're assessing and treating the pelvic floor dysfunction, but we're also curious. We're like, wait, you had an old car accident, some whiplash. Okay, is that affecting or contributing to the pelvic floor dysfunction? So, or we're like, oh, you also have this hip pain. That's interesting. Could that be contributing? So we're looking at the body as a whole and how it works as a system, and like a biomechanical approach, and which can be super helpful for pelvic floor treatment. The second thing we do is look at the person as a whole. So we're looking and assessing how their mental and emotional well-being is. And so, and I think you were talking about it a second ago, is stress response. And so we want to know, how is this person navigating their personal lives? Or do they have a lot of stress in their life? Did they just have a baby and they don't have support? They're just at home alone with their baby. Their spouse went to work already. Or, did they have a parent that passed, and usually that's what we're asking in our history. We're like, okay, your incontinence started 2 years ago. Was anything going on around then that might have been a little stressful? And usually people are not aware of this, but they're like, oh yeah, my dad died and then my grandma died. I had like 3 deaths in the family, or something like that. And then about a couple months later, the incontinence started. And of course, not every single person falls into that. Sometimes it's not as as that, but we see that quite a bit. And one of the big reasons for that is we can actually look at that from an anatomical perspective. So I'm just going to get my pelvis out here. So, okay. So I'm just going to show you we got our pelvic floor here, or we have our pelvis here. So we have the wings of our pelvis here up the front, and then this is our lumbar spine. This is part of our lumbar spine here. And then we have our sacrum here at the bottom, and then we have our little tailbone right there. And then we have our pelvic floor muscles down here. So we have our vagina and the anus back here. And we have 3 layers of pelvic floor muscles. So here we're looking at the first layer back here, the external anal sphincter, and this is the urogenital triangle right here with all these small little muscles through here. We also then have a deep layer here, just in there. So it's a sling of muscles that attach here at the back of the pubic bone here, and it swoops back like a hammock and attaches to our little tailbone back there. And then, what's really cool about our pelvic floor is that it has a direct innervation from this nerve, so it's innervated by a nerve called the pudendal nerve. And this nerve is very interesting and unique in the way that it has direct connection to our sympathetic nervous system or our fight or flight response. And so whenever we're feeling overwhelmed, stressed, or maybe just not managing our stress very well, that's going to have a huge effect on these muscles down here, as well as our pelvic organs. And here they're kind of falling around, but here we have our bladder, our uterus, and then our rectum here in the back. So they're right on top of these muscles here. And so this whole pelvic bowl area has a huge connection to our fight or flight response. And the reason for that is even just biologically, our nervous system in our body is hugely invested in keeping this area safe. So, because for one, we have bladder and bowel function. If we're not peeing and pooping, there's problems, right? And so peeing and pooping, that is very important. We need to get rid of our waste so our body can function.
Mhm.
And so then we have, in this case, the uterus, our reproductive organs in here. And that is important to carry on the human race. So we're wired to keep this area safe. But when we live in a world where we're not managing our stress levels very well and we're running on empty, we're like high cortisol, fight or flight constantly, even at lower level, this area is not going to be functioning well. We're going to see issues, bowel bladder issues, sexual dysfunction, so many issues in here that can have not only an effect on our body as a whole, but especially in our pelvic floor muscles down here. So unfortunately, that's not, so we spend a lot of time looking and assessing and incorporating that into our treatments. And unfortunately, that's just not done in a lot of times in the larger clinics, simply because there isn't enough time and capacity for that. So, so that's one of the big things that we do.
Oh, thank you so much for really going into great detail in that area, because, I never knew or understood how trauma affects the body. Like I didn't even learn about this until my late 40s, when I went into full burnout, overwhelm, was suffering with PTSD and brain fog and memory loss. And I started researching it myself to figure out, how can I continue to function with all of these issues, or what can I do to make them better? And of course, I went to my primary care doctor, who handed me a prescription for an antidepressant. And that was it. There was no other conversation about what my stress level was at the time. No referrals to anybody. It was like, here's a prescription, have a nice day. And so honestly, I fired my doctor and found somebody else.
Good.
And went to alternative health practitioners, working with an herbalist that helped me kind of get out of that stress response, get my nervous system back calmed down. I developed a daily meditation practice, which really, again, helped that calm. And over time, those symptoms started getting better. My brain fog started improving. My memory loss started improving. My anxiety started improving. I saw a hypnotherapist that helped me deal with my triggers. So, getting all these different modalities for my toolbox to help me was more valuable than anything else, and certainly not anywhere that I had previous knowledge or experience with. And even with the amount that I've learned about how the body handles stress, I would love for you, at your convenience, if you could write a blog that I can put in my pile of information, my blogs that I send out, that really go into that detail that you were talking about, because honestly, I had no clue. No clue that it would affect that.
Yeah, I would love to. Yes, I'd love to. I know it's so much more intricate than we realize. And I'm so happy that you did discover how to heal yourself through addressing your emotional, spiritual, and mental health, because I mean, and some people do need a little help with medication, but are we also looking at the non-medicated ways to treat it? Because it's so important, taking care of our bodies and our nervous systems, and just reteaching our nervous systems how to be safe whenever they haven't felt safe in a long time, and maybe they don't even realize that they don't feel safe, because you just get used to living that way,
Mm-hmm.
surviving.
And the only thing that I could, in my mind, relate pelvic floor issues was, that I worked I was an accountant for 20 years, and then I went into legal for 13. And in legal, you're lucky to leave your desk, much less go to the bathroom, or much less make sure you're getting enough hydration in your day. And so I know that had a huge effect, because I just was lucky to go to the bathroom at lunchtime. And then again, before I'd leave the office at the end of the day. It was just so far out of my mind that I just had to keep working, and wasn't taking care of myself.
Absolutely. Absolutely. I know. I actually working with a lot of my patients. I can usually tell if they have a desk job that they're chained to for 8 hours a day, because it is rough on your body, rough on your nervous system, and your pelvic floor hates it. So yeah, it's hard. The world we live in is hard on our bodies.
So you definitely covered some misconceptions, which we just went into.
Yeah.
What are some other common misconceptions about pelvic health?
Yes. So, well, I know I went on this a little bit already, but definitely Kegels. So a lot of people think you're going to go to pelvic floor therapy and do a bunch of Kegels, which you might, depending on where you go, you might spend a lot of time working on Kegels, which I don't actually give that many Kegels in my practice. I do every once in a while, but it's usually just such a small part of my patients' treatments is working on those Kegels. So that's all. I feel like that's just been such a disservice, because that's all anyone knows when they hear pelvic floor. They're like, oh, Kegels, that's the only thing. And it's like, oh, that's not the only thing. So so that is definitely one of the biggest misconceptions. And I do encourage people, if they did go to pelvic floor therapy and it was mostly based on Kegels, to please try someone else. So, and maybe even call them and be like, do you guys, I don't know, do you guys mostly do Kegels? Do you guys do other stuff? So that would be one thing I encourage people to do. The second thing is that pelvic floor therapy is just for postpartum people, which I know I talked about this already too, but everyone has a pelvic floor. So, and anyone can benefit from pelvic floor therapy. And so we at Sacred Roots, we specialize mostly working with women, but there's also men who can have pelvic floor issues. And if anyone, I know some awesome pelvic floor therapists in Albuquerque who do specialize working with men and male pelvic floors. And so I can always, don't hesitate to reach out to me if you need a referral for that. But yeah, it's not just for postpartum gals. It's like I said, pregnancy is an awesome time to get your pelvic floor assessed and treated, and as well as through the lifespan. So I would say those are the biggest misconceptions.
Great. That is very helpful. I've already learned so much just in this little conversation that I had no clue. How can someone know if they should seek pelvic health therapy?
Yeah, so definitely I would recommend seeking out pelvic floor therapy if you're experiencing any type of leaking, even if it's like you sneeze a little bit and you leak a little bit. Although it's common, it's not normal. And it's showing that, and it may not be necessarily that you have this huge problem, but there might be a little problem that might get worse. And so I think if you're having a little bit of symptoms here and there, it's showing that something's going on and it would be worth getting checked out. So there's that. People who are having constipation, especially if it's associated with urinary urgency frequency. So people who are having to pee all the time, having a hard time getting to the bathroom without leaking, usually that's associated with constipation, and that is your prime candidate for pelvic floor therapy. Definitely if you've had, like I said, hysterectomy or any sort of pelvic or abdominal surgery, bowel resection, cesarean, hysterectomy, myomectomy, which is removal of fibroids. And so it's so helpful just to get some pelvic floor therapy afterwards. That's actually a little bit of another soapbox I could be on is if you have any sort of surgery on any part of your body, such as your hips, your back, your ankle, you're immediately going to get a referral to physical therapy for those. The surgeon's going to send you to physical therapy. But why aren't we getting referred to pelvic physical therapy for abdominal and pelvic surgeries? Even though it's not necessarily affecting a joint, it can really affect your organs. And because the abdomen and the pelvic floor muscles are so closely that they're fascially continuous. So the fascia, they're continuous with each other and they work together. And so that disruption can really affect the pelvic floor muscles. So I really encourage people after having abdominal or pelvic surgery to seek out a pelvic floor therapist. And definitely when you're pregnant, just have a few visits, have someone check out your usually we have no idea what's going on, even if we're not, especially if we're not having symptoms. And sometimes even when we're having symptoms, it's like, I have no idea what's happening down there. And a pelvic floor therapist can just check it out and be like, oh, this is going on. You should work on these things. And so I think it's so helpful to get more information about your body and where to go forward. Like, should you be doing Kegels? I would say most of the time the answer is no, but every once in a while, yes.
And what about you brought it up earlier, like pain with intercourse or, again, perimenopause and menopause where there may be vaginal dryness. Those are also things that you work with, correct?
Yes, absolutely. Thank you for mentioning those because that's a huge part of our practice. Having pain with intercourse, again, can be common, but it's not normal. And so after going to your OBGYN and ruling out any sort of infection or anything, and if you're still having pain, then it's oftentimes musculoskeletal. So it might be an old scar, or it could just be your pelvic floor muscles are like frozen in a state of tension and tightness, and it could go back to the nerve. There could be a big nervous system component of a fight, flight, freeze thing happening, or oftentimes it is that as part of it, but the muscles are really tight. So that's not normal. And, you know, if it was, I could tell you, be like, oh, just relax. And then the person's like, okay, I think I am, but their pelvic floor is still tight as heck. So learning how to reconnect with this area and learn how to have return to normal functioning of the pelvic floor, that's what we do.
So do you do like mindfulness work, breathing techniques, um, even like body scan meditation, where people can really get familiar with their body parts that are maybe having these symptoms and learn those techniques for relaxing them? I know that body scan meditation is like one of my favorites, especially if I'm carrying a lot of stress in a certain part of my body. Just to be able to completely relax, feel where that stress is, learn breathing techniques to kind of learn how to relax those places, or at least to become familiar enough to be able to then go to a doctor or a practitioner and say, you know, I've tried these things and I'm still having this pain.
Yes, absolutely. We do a ton of mindfulness. We do body scans. We do a lot of hands-on myofascial work. We do also hands-on myofascial work affecting the nervous system. So we do work along the pathway of the vagus nerve to help calm down the nervous system, and help. We're doing anything we can to assist the body to get out of fight or flight mode, and also doing some retraining. So someone who maybe is having pain with intercourse, and this could be someone who had maybe a trauma earlier in life, or maybe some sort of assault that is affecting, maybe not though. We work with people who have and have not. And I mean, and I have patients where they share with me later on. And so kind of how we treat is we assume everyone had some sort of traumatic event, and that's how we are very gentle and non-pushy with our patients, because this is a very vulnerable area and there have been a lot of people that have had trauma in this area. So that's just a little aside. But we also will teach them, it's like graded exposure therapy, I guess is kind of the word for it, but them learning, like maybe someone cannot tolerate an internal, like a speculum exam at an OB/GYN, or even a pelvic floor exam where we're just using a gloves lubricated finger just gently inserted into the vagina. They might not be able to tolerate that. So then we might even have them work, that part of their home program is not even to touch like to insert their finger into their vagina, which might be part of their program, but maybe they can't even tolerate that. It's bringing up a fight or flight response. So maybe they're just touching their belly and they're breathing. Yeah, because we do a lot of breathing as well. And so they're breathing, maybe they're touching and they're finding safety. It might be a little uncomfortable, but they're teaching themselves like, no, this is safe. There's no harm being done here. And from there, they're kind of reframing a, a touch or a sensation that their nervous system used to scream, this is danger and we're about to get hurt, to like, no, this is okay, nothing dangerous. And then we progress from there. But yeah, a lot of it is like teaching people how to get reconnected to these areas that maybe through trauma, or who knows, a traumatic birth, or maybe even they just grew up in a household that was like, don't talk about your no parts, don't touch them, don't, that's bad. You know, that's also a common thing too, where people are like, that's a yucky area. But then now all of a sudden they get married and they're expected to have sex. And it's like, wait a second. And then all of a sudden they're supposed to be totally fine with having, you know, maybe sex. And so, yeah, so there's so many things that can influence it. And so having a lot of reframing, but we also do, like I said, breathing. We do a lot of myofascial work. And then we do also kind of the normal PT stuff. So we're assessing joints and we're doing exercises if needed and that sort of thing. So
I love it. Again, it's getting that information in front of somebody. I mean, I remember, the names that parents use for our body parts when we're little. I grew up Catholic, so of course it was the don't touch, don't talk about it. We didn't have any of those conversations in my house. And then, of course, like I said, without knowledge, I ended up pregnant young and just had to figure those things out for myself and still didn't know how to have those conversations, even with my partner. And so that is something that I work on as part of my coaching, because part of my coaching, I also work with people in the kink and BDSM lifestyle, because the level of communication is so much deeper than it is in your traditional relationships.
oh yeah,
You're expected to really communicate everything, your limits, your boundaries. How does this feel? Do you like this? Do you not like this? And you are in control of what you like and don't like. And I think that for me, and wanting to work with people on this, is because it is so empowering for especially a woman, but for everyone, to be empowered to use your voice and to be in a relationship where it is safe to do that and where you feel safe having those conversations.
absolutely. I 100% agree. I'm so happy you're at at the point now where you can have those conversations, those healthy conversations.
Mm-hmm.
Oh gosh, I know. There's so many women I work with who they don't even know that they can say something, that they can say like, oh, slow down, that hurts, or uh, it's like the more communication the better. And yeah, so, and also so many women that have no idea about, they might have heard, of course, heard of having an orgasm, but haven't actually had one. They have no idea how.
Mm-hmm.
um, and so having that education, I think, is so important. And I'm glad it's more accepted now. I mean, it's still not perfect, but I'm so happy we're able to have these conversations now about it, and people not to be too uncomfortable. So
Yeah, because like you said, those are vulnerable conversations to have, and even vulnerable conversations that a lot of people don't even have with their doctors or their OBGYN. They just don't share those things. And so, for me, learning and developing those skills and in my relationships, and not worrying about having to keep those conversations to myself because I'm too afraid of how my partner's going to respond. If I say something like, can you slow down? That hurts. Can we change position? Can we try something else? To where you're not as worried about their ego, and that it's mutual pleasure. So if I
absolutely.
tell you I'm having pain or I'm uncomfortable, and you listen to what I say and make adjustment, then we're both happy in what we're doing, and not this one-sided sexual relationship that's all about making the man happy and not about our own happiness.
Exactly. And that creates safety. And then you're able, when you feel safe and comfortable, you're able to have capacity for pleasure. So, yeah.
So as a practitioner, what do you find most fulfilling about the work that you do?
So, of course, I love hearing stories of patients getting better. So it could be anything from uh, one of my patients can jump on a trampoline with her kids now without leaking. Um, or, and this is some of the fun this is a fun one for me, is someone who comes into me having an incredible amount of difficulty having intercourse without pain, and they want to get pregnant. And so uh, working with those gals is so fulfilling, especially whenever they get pregnant after they can have sex without any issues. So that's definitely, that brings so much warmth to me. But I think just from a zoomed out perspective is I love bringing a space that people can come to and feel comfortable to share. And I tell people, like, nothing is TMI. Like, I'll have people, and of course it's the first time they met me and they're like, oh gosh, this is too much information. And I'm like, no, it's okay. I promise you, it's not going to be too much information. Is having a space where people can come and be like, I'm having this issue with this that is, of course, very vulnerable and uncomfortable. They're embarrassed and feeling a little shame around it. And then just being able to tell them, like, look, you're not the only one dealing with this. We see people like that all the time. That's what we do here. And we're going to help you get better from that. So even just having people be like, oh, like, that's such a different experience than when I saw my doctor, who just wanted to give me a medication and like was kind of dismissive, or, and so we're always like, you're going to be 100% accepted here. And we're going to do everything we can to help you feel better in a way that feels most comfortable for you. So I would say, that brings me the most fulfillment
Yeah.
for
Yeah, I agree with that. I like the providing a safe space
yeah.
for people to be okay with sharing those vulnerable things. And, during school to get certified as a health and life coach, they kind of tell you that they don't want you to share so much of your experience. And for me, I'm like the opposite end of that pendulum. And it's my experience that makes people connect to me and not feel alone, or know that I've gone through different things, marriage, divorce, being cheated on, intimacy issues, communication issues. So for me, I like to share my story so that people can feel more accepted, more not alone, more in a safe space. It's not just you. You're not alone in this. I'm here to walk beside you. So yeah, I love offering a safe space and working with people in that level.
Absolutely.
Let's talk a little bit about, you and building your business, so that we include this for our entrepreneurs as well. What challenges have you faced while growing Sacred Roots?
Yeah, so there's a few different challenges. A big one is the personal growth I've had to do to get where I'm at. I am a 100% a people pleaser. I still am a people pleaser. I'm a little better than I used to be. I could not say no to anyone. I would be treating at 6 at night, treating on days I originally was like, I'm not going to treat on these days. And because I really tried to have a day during the week where I could get administrative stuff done. I could work on my business. Because if I'm just treating patients all week, I'm not getting any marketing done. I'm not getting all the administrative. I'm, late on filing my gross receipts tax. Not really. I'm never late. But but then I would have a really hard time. I'm like, oh gosh, this person can only come on Mondays and I'm not treating on Mondays, but I'm going to make an exception. And I'm like, oh, since they're going to come on Monday, I'll go ahead and book a couple other people on that Monday too. And then it's just, and I'm not perfect by any means, but I'm still do this occasionally. But one of the biggest things I've learned is to say no, because right now I just don't have as much time. And so I'm learning to say no. which is hard for me. I'm I am trying to be where I look like, okay, if I do this thing, not that this might sound a little selfish, but if I do this thing, um, do I really have the capacity for this? Is this gonna benefit me and my business somehow, or am I just doing it because I don't want to let a person down? And of course, we're always weighing that, because sometimes we do have to do stuff that we don't want to do as business owners. So learning to say no, learning to have more firm boundaries, and uh, and that has been important. And then as being a business owner with employees, that has been another uh, a level of also being a solo business owner is one thing, but then having employees is absolutely another thing. So that's been something I've been working on, is because I'm a people pleaser with my employees. Surprising. So being able to be like, okay, I want to provide the best workplace possible, and I want to be compassionate and considerate of my employees in the same way that I am with my patients, but at the same time, I can't say yes to everything. So that's another hurdle I've been working on right now. And of course, I got like the best employees. They're awesome. I'm so lucky to have them. But yeah, so that's been something I've been working on currently. Uh, Another thing, when I first started my practice, I was such an introvert. I still am an introvert. I'm definitely not extroverted. So putting myself out there, I was like, oh no, someone's going to say something mean about me, or I don't know. I was just so, it was a little bit rough for me at first, but then I'm like, okay, well, I have to put myself out there if I want to, if people want to find me. And so that has been a huge growth, uh, personal growth development I've been experiencing. And I think extroverts are probably so much better and faster at building their businesses. And so that's one thing I've been having to be like, okay, this is, I'm having to encounter more obstacles, maybe on a day-to-day basis, with being an introvert, being a people pleaser. It's versus maybe someone who's extrovert, loves going out and speaking to a whole group of people and all that. So, but I'm getting better at it. I'm here with you.
You are. And those are great. I mean, I think a lot of us business owners, we go through those things. I know I did as well. I came from my own self-image issues. Never liked to have my picture taken, didn't like to be in pictures, avoided it at all costs. Um, and then here I am, a business owner, and I'm building my website. And I don't want my website to be nothing but stock images. I don't want people to be like, well, who is this woman in this picture? Does she work for you? Oh, no, it's just me. Well, where are you? I want to see you and know more about you. So I had to, get over myself, get out of my own way, get over my self-image issues, and hired a professional photographer to come into my office and photograph my office and do my headshots. And even this morning, I was thinking to myself, it's time I need to do that again. It's been 3 years. I need some new headshots. I can't just live on the two that I've had all this time. And so knowing that you kind of have to lean into those uncomfortable things to help us build our business. I'm the same too. I don't like to get up and teach in front of a bunch of people or talk in front of a bunch of people, but I've been put in situations where I know that it's a personal growth and I have to lean into it. I got involved with 1 Million Cups, which works with entrepreneurs here in Albuquerque. And one of the first things they want you to do is get up and present about your business and where your struggles are, so that these other entrepreneurs can help you with your struggles. But just getting up in front of a room of people that I had never met, didn't know, and having to present my business and my struggles and how I overcame certain things, was very difficult, but each time I do it, I'm stronger for it.
Yes.
And
Oh, I completely agree.
I've been
Makes
really
it
blessed
easier.
with people putting those things in front of me. You
Yeah.
know, teaching. I'm now getting ready to teach my second or my third um, podcasting class, teaching people how to have a podcast. But that requires me not, to prepare for it, to make handouts, and to stand up in front of a room and teach. I haven't taught people in 30 years. So now I'm like, okay, I have to do this. And then I get through it. And at the end of the day, my heart is like 10 times its size. And I'm so filled with, everybody else's happiness and joy and excitement and what they want to do next. That I'm like, oh, this is great. Like I have held myself back for long enough.
Yes, absolutely. Oh, sure. Yeah, I can 100% relate to that. Yes, we hold ourselves back just by being scared and nervous and unsure, like, oh, do we deserve to be up there? Who really wants to hear from me? Like, I don't have anything to say. That is, those thoughts are really, they're really bad for us,
Mm-hmm.
in any capacity, but especially as business owners. I think especially as women, as female business owners too, I feel like we have to deal a lot more with that. We have to unlearn so much.
Yeah.
Like our voices,
Mm-hmm.
our voices have been suppressed and we have to find them again.
Yeah.
So,
Yeah. And imposter syndrome's a real thing. Like I said, I was an accountant for 20 years and then I switched to legal. And so that was like starting all over again. And then I leave legal and now I'm a coach. So who am I to coach? Okay, so I have education, but everybody knows me in the legal field or everybody knows me as an accountant. But I think that those experiences are what make me a better coach because I've had all those experiences. I've had those different relationships, either with bosses or with coworkers. So I think that if we learn to pull into ourselves all of our experiences, that we realize how much stronger we really are than we give ourselves credit for. And like you said, as a woman, having a voice and, being able to say, I'm a business owner. Like,
mhm.
I'm not working for somebody for the rest of my life just to make money to provide for my family. I've faced those fears. I've taken those steps and be proud of our accomplishments and celebrate those accomplishments as often as we can, just for ourselves.
Absolutely. Yeah.
So, what's next for Sacred Roots?
So, um, I'm hoping in the next year to bring on another therapist. Um, I have a space issue at my clinic. So that's one thing me and my husband right now are trying to figure out how we're going to navigate that. If I'm going to reduce my patient hours to make space for another therapist. Do we need to find a new clinic? So those are all the kind of the whirlwind of uh, things going on in my head at this time. But I'm hoping next year to have another therapist, either a PT or an OT, working with us, and yeah, and I'm hoping to get my crap together and have maybe some more community classes, either at our office or someone else's office, and just to have more uh, educational events for the community, maybe people who can't come to see us, that just have more, a way to like give back to the community a little bit more. So that's my hope, is to do that.
Well, let me know when you're ready to do that because that's part of what I have enjoyed doing
Oh, yes.
as part of my business is supporting other entrepreneurs and getting past those things. And for the first 2 years, I was hosting those type of events in my space So I'd advertise out on all events. And so, and then bring people in from the community and say, hey, this person's going to be here just to teach you. Come and sit and learn and be in community with other people and be in a safe space where you can learn new things or learn things maybe you didn't know. And I found it so absolutely fulfilling, just to be able to offer those, an hour just to stand in front of somebody, like you said, with your little thing and explain all those things that we don't get from our regular doctors. So yeah, let me know when you're ready to take those steps. It really is very fulfilling to give back to the community and to provide that information is out there and available, because people are seeking it.
Absolutely. Yes. Thank you, Leann. I definitely will be interested in that. I need help.
And it's a lot of fun. And again, that was one of those things that I brought from my previous experience. I worked at the Chamber of Commerce for 4 years, very early in my career. And that was one of the things that I did for the Chamber of Commerce, was host what was called a business at breakfast or a business after hours event. So I had that experience. And when I first opened my business, I was talking to my mentor and I said, oh, I think I'm going to join the chamber. And he's like, didn't you say you worked there? Like, you know how to do this. Why are you not doing this for your clients? Oh, yeah. Like, never would have even thought about bringing that experience into my current situation.
Sure, yes.
And it was so easy because it was like, oh, I know how to do this. Oh, I can handle catering and I can, and send out invitations, and I know how to make name tags and set up tables and chairs. That's the easy stuff.
Mm-hmm.
So just, remembering things from our past that can really lift us to another level in our current careers and help us continue to grow.
Absolutely.
So before we wrap up, what advice would you give to women who might be hesitant to seek help for pelvic floor issues?
Yeah. So, this is a tough one, I think, because it can be so individual. I completely understand women who maybe had traumatic medical experiences in the past, like going to their OBGYN and having an insanely painful pap smear, and so it's like, gosh, you're like, the last thing I want to go is see another medical professional about that. And so I would recommend, um, sometimes people aren't ready for pelvic floor physical therapy. And so sometimes doing some mental health therapy first, or even in conjunction with, can be very helpful to help if there has been some trauma, to help work through that a little bit, learn how to regulate your nervous system. Another thing I would say is, as a pelvic floor therapist, I mean, most of my patients get an internal exam and it's very gentle, and I always explain it first and get consent and all that first. But I have some people come in and they're like, I don't know if I'm ready for that right now. And that's okay. That means we're not doing an internal exam. That means we're doing a lot of other stuff. So we're going to be looking at hips, low back. We're going to look at the whole body. We're going to talk about stressors. I might give you some homework that, of course, I'm always gauging, like, how comfortable are you doing this at home or here, and so we're doing a lot of education in that regard. I would potentially recommend some sort of meditation, breathing practice to connect with your body. There's quite a few people who, as a disclaimer to that, there's quite a few people who have real bad PTSD or some real traumatic experiences that their body is still holding on to. Sometimes the mindfulness and breathing practices can actually trigger a PTSD response. So be on the lookout, take care of yourself, and get in with a trauma therapist, because sometimes you need to work a little bit of that out first.
Mhm.
If you cannot even imagine someone touching you, or I don't know, even talking about that stuff, it is probably an indicator that you might need to get some trauma therapy first. And find a therapist you like, whether it's a mental health therapist, a physical or a pelvic health physical therapist. Is you have to like the person. And so, and it's hard, especially in New Mexico, we have a hard time finding therapists, but it's so hard here. But if you don't like them, then don't continue to see them. If you don't feel comfortable with them, find a new therapist. And so that's, I think, some of my biggest advice. Even starting with some yoga, as long as it's not aggravating to your symptoms. So join a yoga class, or even just do some yoga, gentle yoga on YouTube. As long as it's not, it shouldn't aggravate your symptoms, but even just to help, maybe movement can help you reconnect with your body in a way that feels safe for you. And then hopefully the next step would be finding a pelvic floor therapist. So do you think that's
Absolutely.
okay?
Absolutely. And, it's so valuable to meet people where they are. That's
Exactly.
where we really have to start. And like you said, and knowing that, what might work for one person isn't going to work for another person, because we are all unique. And knowing, that whole body, asking those questions, really helps you to kind of gauge where that person might be and see if you need to recommend that they work with somebody else, because I'm not going to be everybody's cup of tea. And so I can say, well, if you're not comfortable with me, let me refer you to another coach. I am more than happy to do that. Or let me refer you to a therapist, or, kind of help you find those other options. Because I want to meet people where they are, and I want them to feel safe and want to work with me.
Exactly.
And be able to communicate and know that you, like you said, if you don't like your doctor, then find another doctor. You can do that.
100%. Yes. You should like and feel listened to by your doctor, therapist, whoever. I mean, gosh, and our medical model is real messed up right now, but there are good practitioners out there, and it is hard to get in with anyone, but uh yeah, it's try a different one, ask for recommendations. I'm part of a few Facebook groups that like women Facebook groups, and then people are always asking, like, does anyone have a good OBGYN referral or recommendation, or even a PCP recommendation? Because if you do have to go to the doctor, you can try to get in with someone else had a positive experience with. And so it's really hard. It's not easy. But it's possible.
Yeah. And I think having a solid referral system for our clients or patients is, you know, probably one of the best things that I can do to refer people out. And again, that's sharing my story and saying, this worked for me. If it's something you'd consider, oh, this event's coming up, maybe go and check out this event and see if it's something you'd be interested in. Has been very helpful for my referral partnerships that I have with other practitioners, because I can, share my story and say, this is how it helped me with my trauma triggers, like hypnotherapy, and be able to, say, oh, okay, well, my hypnotherapist is also a guest on my podcast. So you can go and listen to that episode and see if maybe you feel connection with that person before even making an appointment or going and meeting with them. So that, this whole thing that I've been putting together for the last 3 years is all come full circle, so that I can provide the best care for my clients.
Absolutely.
So helpful.
Yes.
So one last question. Where can people find you?
So, you can visit my website. It's sacredrootspelvichealth.com. If you're in the Albuquerque area, you could come see us in person, have an appointment, and you can get more information about that on our website. And also our phone number and all the ways to contact us is on our website as well. And we provide 1 hour and appointment times, and we also offer 2 hour appointment times for people who are coming from far away, like Los Alamos, Taos, so that we do see people from other parts of New Mexico, and we offer longer appointment times for those folks. And you can also find us on Instagram, which is at Sacred Roots Pelvic PT. And yeah, I think that's it. I'm also on Facebook at Sacred Roots Pelvic PT.
Wonderful. I'll make sure and include all that information so that you can contact Dr. Amy. Will be in the show notes, as well as a list of the services they offer and treatments they provide. And please take a look at their website. It's a beautiful website. I really like it. It's very informative. Thank you so much, Dr. Amy, for sharing today. You have educated me on things that I didn't know. I'm sure this conversation will educate many other women. I'd like to do more with you to continue to share what you provide to other people, whether it's in a blog or an event. I would love to do more with you.
Thank you, Leann. Thank you so much for having me. I would 100% love to work with you again. I love the blog, and I would love to go to any events you host. So thank you so much for having me.
Oh, thank you. And thank you to our listeners for tuning in to the Happiness on Tap podcast. If you enjoyed this episode, please subscribe, leave us a review, and share. Until next time, take care of yourself and each other. Thank you, everyone.